everyone. My name is Dimitri. Today's episode number 3 of podcast Therapy Entrepreneurs. Our guest is Catherin from Prokinetics Physical Therapy. Hello, Catherin.
Hi.
All right, so today's episode, we're going to have similar questions to last 2 episodes regarding her clinic. So what is the exact name of your clinic, Catherin?
Okay. Physical Therapy.
Okay, and where are you located?
Carroll Gardens in Brooklyn, New York.
Okay, very good. And what is your clinic specialty? What kind of population do you treat?
We do mostly orthopedics, but we also see some pelvic floor and some pediatrics. And we have a specialization in the Tupler technique, which is a treatment for diastasis recti. And our population is generally between the ages of 20 and 50, because that's pretty much the population in this area, but we do see all ages.
Okay. Sounds good. All right, and when did you open? How long have you been in business?
July 2014, so we're coming up on 6 years.
6 years, all right. And so how much money did you invest to open up your clinic?
I invested about, I'm going to say $50,000 roughly. I did have some, we'll say, donations for some equipment. So if I had to buy all of that, probably, I think would have been about 20 grand more. But
so you're saying, so you had $50,000 that you personally put into the clinic, and then you had equipment that was donated to you, right?
Yeah.
Okay, sounds good. So did you have any finance? Did you have any loans from banks and things of that nature, or was you safe?
I saved money because I don't like having debt or having to pay interest on things.
Okay, that's great. And do you have any partners? Did you have any partners when you open up? Things like that?
No, just me.
Just yourself. Okay. And how big is your office? How many square feet is it?
It's 1,500 square feet.
Okay, so it's a nice size office for New York City. All right.
Oh, yeah.
And then are there any therapists working besides yourself, or are you the only therapist?
I have 1 full-time and 2 part-time therapists.
I see. Okay, sounds good. And then your front desk, so you have a front desk staff, right? You have like office staff besides your
so
therapist,
the
right?
office, like aides and the reception, about 10 employees.
How many employees is it altogether?
10, support staff, reception, and aides.
All right. Okay. So, and do you utilize a billing company, or are you doing in-house billing?
Yes, that's what I forgot my biller. She's one of my employees also. So she actually
Okay.
used to work as my receptionist, and then, slowly she became my biller.
Got it, sir. Okay. So you're doing in-house billing. Actually, your camera just disappeared. You still with me?
Hello?
Yeah. You still with me? Because I don't see you on the camera anymore.
Just lost you. Hold on.
Okay, we're back in business. Good. All right. So okay. I see you now. So you're saying you have in-house billing, so that's great. And then she's part-time, right? She works for you part-time. All right. Very good. So what's your best referral source? Would you say? How do patients find you? Do doctors send them? Do they find you online? Is it certain clubs you belong to, or certain network groups, things like that?
It's a mixture. I think a lot of the people at this point come by word of mouth, but we do get a lot of, people who find me on internet searches. This area, especially, a lot of people are not from the area, so they have to go online and find, their doctors, their therapists, not, go to other neighborhoods. People have lived there for a long time. Their parents grew up there. They'll just go to whoever, their family members or friends go to. But over here, it's a lot of internet searches and people look at reviews, and so I get a lot of patients like that. And I have made some relationships with various doctors in the area, and also a few in the city that have patients in Brooklyn that they can send us to.
I see. Okay, that makes sense. And so, what is it? How much are you spending on marketing monthly?
I'd say anywhere between $1,500 to $2,000 a month.
So from 1,500 to 2,000.
Yeah, and mostly internet.
Internet, yeah. All right.
Yeah.
Can you tell me specific platforms you utilize, like Google, Facebook, Yelp, things like that? Is that what you use?
So I use ZocDoc. It's pretty big in this area. A lot of people find me on ZocDoc, and they used to have just charge you like a yearly fee, but now they charge you per appointment. So every patient that goes through them, I get charged. And
I'm sorry, which platform are you talking about right now?
ZocDoc.
.com?
It's ZOC.
ZocDoc. Yes. Sorry, ZocDoc. Yes. Okay, so
I know
I see.
Internet's a little weird just now, but yeah. So them, and then I have a company that I use for my website, and then they do my Google ads and everything like that. And then I have another company that manages my social media, Facebook, Instagram.
Okay. Wow. You're so very nice. So you have multiple companies that help you with marketing, and it seems to work for you. Very good. All right. So say it again.
All about the marketing.
Yes, absolutely. Okay, and it seems like you have it. You have it in the right place. So in terms of certifications, because I look at your website, right? So you do like a lot of orthopedic stuff. There's something called Toplet technique that some of the listeners might not be familiar with. Is that something you hold a certification in, or is that something you guys provide with, it doesn't require any certification?
Yeah, so the Toplet technique, I was certified by the woman who created the program. And, it's a pretty short training program, but you get certified, and then the woman she's a nurse, an RN, and I lost you for a second. Hold on.
Yeah, you disappeared actually. I don't see your video.
I think the internet connection is a little slow now. Let me see if I can go in a different room.
I mean, I hear you well. That's okay. Yeah, I see you.
Okay.
Very good.
So the woman who created the program, she was an RN, and she was working in the NICU, and she was seeing a lot of this problem, diastasis recti, in a lot of new mothers, and nobody had a treatment for it. A lot of doctors just kind of brush it over. So she really did all the research for it and in depth to it, and then she designed this program, and then she trains certain people that she chooses, usually physical therapists or personal trainers, and she, teaches the program so that we can then be licensed in her program and, treat others with this condition. So it's not typical physical therapy. It's not like you're going to PT twice a week, that kind of thing. It's just a training program, we'll call it. And then, the patient can feel the diastasis with it.
No, this is actually great. This is very unique. I haven't personally heard another physical therapy clinic offering this, and that's exactly what I call 2020 type of clinic, where you don't just treat typical kind of PT-related conditions. You think outside the box, and you utilize other services for your patient. Very good. All right, so that's. And you also, I know you told me you guys also do pelvic floor therapy, right? For your patient. That's another condition you guys specialize in your clinic, right?
That's another area that we decided to keep, because especially in this area where we're located, there's a lot of new moms. So not only do a lot of the Toplet technique, a lot of times pelvic floor issues arise or are combined with the diastasis recti. So there was a need for it, and just like the Toplet technique, not many clinics have it, so it was a good, idea to offer that here.
Okay, very good. And so do you hold any certifications?
No, like clinical certifications, no. Just my doctorate of physical therapy.
Got it. Okay, and then you just completed some trainings in, in certain fields that you guys specialize in, right? Okay, good. And so how many hours a week do you work, would you say?
Give or take, I would say 50 to 60 sometimes. Mostly I would say around 50 hours a week.
Okay, so above, average kind of work week, basically. So
Yeah, I mean, treating patients, is different than, sometimes I have to take work home with me or I have to stay late or come early. So, you include that.
Okay, makes sense. And that's only treatment time, or that includes documentation and practice management?
No, that's including documentation and practice management.
All right, so 50 hours. Got it. So, and how many patients you guys see in the clinic a week on average?
Between 30 and 40 patients a week.
Between 30 and 40, is it visits or patients?
Patients. I'm sorry, a day. 30 and 40 a day.
Okay, so 30 to 40 patients a day. So, and you guys open 5 days a week, right?
6 days. So we see, somewhere around 200 a week.
Okay, so that's a pretty good patient flow, 200 200, right? Okay, very good. And what's your cancellation rate? Do you guys run the report just to see how many patients cancel out of those 200 that you have scheduled?
Cancellation, I mean, it varies also, depending on the season and if there are holidays. Generally speaking, I say it's around 10 to 15%.
Okay, so that's pretty good. I would say below average. Is there anything you guys do to prevent cancellation or make sure you don't have a high cancellation rate?
We have a cancellation policy, and we charge $25 cancellation if they cancel less than 24 hours in advance. The first few times, or if it's someone who's very consistent, here and there, we're not going to charge everyone, but repeat offenders.
Yes, you give them a warning.
Yeah, and you have the patient fill out the form when they first come in, so they actually see it, and they have to sign off on it, so it kind of sits in their head a little bit, and that seems to work.
Makes sense. Okay, that's very good. And is that so? In terms of reports, you guys, what EMR system do you use in the clinic?
WebPT.
WebPT. Okay, very good. And you guys utilize reports that WebPT offers?
Yeah. Mm-hmm.
Okay, very good. And do you know how much you pay approximately a month for your EMR system?
How much I pay? I think it's I want to pay $1,200 a month.
$1,200 for your documentation system. I see.
That's also including the billing portion. They have a billing software that they connect with the EMR. So.
Got it. Okay, so to about $1,200, and that's your 3 therapists and office staff at the billing front desk.
Yeah.
Okay, very good. What is the most important report in the clinic that you run monthly that you can't live without?
I would say just how many actual treatments we see. Whether it's an eval or a treat, I'll say that they're both the same thing. How many visits have we had?
So you actually you break it down. You look at your evals and then you look at your total treatments, right? So you kind of filter those.
Yeah.
Okay. All right. So that's number one report. Mm-hmm.
Yeah, and I would say second to that is how many evals, how many new patients are finding us and coming.
Makes sense. Okay. Yeah, I agree with that one. And what would you say your biggest expense in the clinic?
Probably payroll. Then after that, I would say the rent, because over here the rent is very pricey. And after that, maybe marketing. I'm not sure.
Mm-hmm. Yeah, actually makes sense. That's what it's supposed to be. Yeah, for your type of clinic. And how much you pay rent monthly?
6,300 a month.
6,000. Yeah, so it's, I mean, New York City, yeah, rent could be very steep. Yeah, that's your average rate for 1,500 square foot office. Okay. And do you know your annual growth revenue for your clinic?
About 480.
480,000 a year. Got it. So that's what you get from cash patients, insurance patients, right? All types of insurance. All right. That's very good. Seems like a healthy clinic. And so last question, in this episode, what is your long-term plan? What do you see yourself, right, in maybe 5 years?
I go back and forth with it. At first I wanted to open, multiple clinics, have a whole chain of offices, and, be a big, large company, maybe have some occupational therapy in there and maybe, other types of treatments, maybe massage therapy or acupuncture, make a big wellness clinic. But, I'm not sure if, I've also thought about that we're dealing with a lot of issues with the insurance companies and reimbursement and how many hoops they're making us jump through. And sometimes I think that that's not the best idea. So I haven't really decided yet, but that was my initial plan.
Got it. Okay. Makes sense. And, okay. And are you married?
I'm engaged. I'll be married in a few months.
All right. Congrats. And you have any kids?
No children.
No children. Okay, very good. Say it again. I'm sorry, I couldn't hear you.
Business is my baby.
I see. Yeah, that's sometimes what happens. You put out the things on hold when you have a business, and you got to put in these hours and do extra things, and don't have enough time for your family. Catherin, thank you so much for your time. It was a pleasure, and I'll speak to you soon.
No problem. Yep.
Take care. Good luck.
All right. Take care. Bye-bye.